Assalamu alaikum everyone. I'm Dr. Warisha, the House Officer, Akhtar Saeed Dental College, Lahore. Today I will be presenting a topic of obstructive sleep apnea. So what actually the obstructive sleep apnea is? Obstructive sleep apnea is defined as a sleep-related breathing disorder marked by the repeated episodes of complete apnea and a partial hypopnea, upper airway obstruction during the sleep. Each episode lasts about 10 seconds and there is a reduce in a blood oxygen level. The obstructive sleep apnea is considered severe if the respiratory disturbance index is greater than 30. If we talk about its global burden, about 936 million adults are worldwide suffering from obstructive sleep apnea. In Pakistan, according to the recent study of 2025, about 35% Pakistani population is suffering from obstructive sleep apnea. The 4% of the middle-aged man and 2% of middle-aged women is suffering from obstructive sleep apnea. The etiology of obstructive sleep apnea is characterized in the anatomical factors, the non-anatomical factors, and associated medical disorders. The anatomical factors include the micrognathia and the retrognathia, the facial elongation, the mandibular hypoplasia, and inferior positioning of your hyoid bone. All of these structures led to the nerving of your airway. The non-anatomical risk factors include obesity, advanced age, male gender, pregnancy, alcohol use, and smoking. The associated medical disorders are the endocrine disorders, especially the diabetes mellitus and hypothyroidism. The neurological disorders include the stroke and spinal cord injury, the Down syndrome. In the Down syndrome, as the person has a specific facial appearance, and there is the deposition of the fat at this region, and there is a narrow mandible and congested heart rate. If we talk about the pathophysiology of obstructive sleep apnea, so what actually happens in it? The person suffering obstructive sleep apnea during the night, there is a reduce in the upper airflow muscle reactivity, and there is a resulting in a reduce in a lung volume, which resulting to the hypoventilation. The upper airway muscle activity reduces, and there is the narrowing of your upper airway, and person go to the state of the hypnea or the hypopnea. This state is detected by your brain, and the effort is maintained to increase your breathing. The aerosol occur, the upper airway reopen rapidly, and the person return to the hyperventilation stage. The reduction in the carbon dioxide level is done, and there is increase in oxygen level, and person return to the sleep. And this all cycle repeat frequently during the night. The common signs and symptoms are divided into the nighttime symptoms and the daytime symptoms. The night symptoms include the loud persistent snoring, witness pause in breathing, the choking and the gasping of air, the restlessness sleep, and a frequent visit to the bathroom. The frequent visit to the bathroom is associated with the hormonal response. So when there is the pause in the breathing, the heart detects this signal, and there is a release of the ANP hormone, which signals your kidney to extract more salt and water, and this results in a frequent urination. The daytime symptoms include the early morning headache, the daytime sleepiness, the poor concentration, irritability, and falling asleep during the routine activities. Although the history plays a very critical role in identifying the patient of obstructive sleep apnea, but certain investigations are done, which include the nasopharyngoscopy, the lateral cephalogram, the MRI CT scan, and acoustic pharyngometry. These are the two most common investigations that are done, and the Epworth Sleepiness Scale is used to detect the severity of sleepiness. If it ranges from 0 to 24, if it is from 0 to 10 it's normal, 11 to 12 it's mild, 13 to 15 is considered moderate, and 16 to 24 is considered severe. And the other most important investigation is a strong brain questionnaire. In this, if you see in the figure, the following questions are asked: do you snore loudly? Do you often feel tired? Do you have anyone observe you stopping your breathing during the sleep? Are you currently being treated with the high blood pressure? If your BMI greater than 35, if your nerve circumstances greater than 40, and are you the male? According to the answer, if it lies from 0 to 8 has a low risk, 3 to 4 has an intermediate risk, and 5 has a high risk of obstructive sleep apnea. The most important investigation, which is considered the gold standard, is your polysomnography. If you can see in this figure, there are the sensor at the nose to measure the airflow, the sensor in the face and scalp measure the movement of brain activity, The elastic band around your chest measures the amount of the breathing effort, and the sensitive finger measures the amount of oxygen. So this picture and this investigation gave us the apnea hypopnea index score. If it is less than 5, it's normal. 5 to 15, it's mild. 16 to 30, it's moderate, and greater than 30, it's considered severe. So the treatment of obstructive sleep apnea, there are the various treatment. We go from the non-invasive to the invasive procedure. Non-invasive procedure include the lifestyle and behavior modification, the positive airway pressure therapy, oral appliances, the oropharyngeal exercises, the surgical treatment, and upper airway electrical stimulation. The oral appliances that are generally given and they are normally very compliant to the patient are the soft belly lift devices, the tongue retention devices, and the mandibular advancement devices. These devices help in the forward positioning of your mandible, increasing in your upper airway neuromuscular tone, and increases the upper airway spaces. The non-invasive and the surgical procedures, they included the genioglossagal tongue advancement. It you can see in the figure, the bone fragment with attached tongue tendons pulls through the lower jaw and you widen your airway. The uvular is done, in which the increase the uvula is your excised and the more space is formed. The other is the mandibular advancement device, in which there is the mandibular cheek is advanced forward, and hyoid suspension device is done. Hyoid bone suspension sutured over the thyroid cartilage. Thank you.